She's 7 years old, and has such an amazing personality. She's the youngest of 5, and she's so funny. She's crazy, and she's
the littlest girl in her class and the biggest personality.
Absolutely, yeah. We took her to her pediatrician on Saturday morning. They gave her Claritin and albuterol and thought maybe
It was asthma.
It was asthma. She didn't have asthma, but that's what they gave her.
We received on Mother's Day that morning a phone call from a nearby hospital that they had this little girl who had profound septic shock. I need to get over to that hospital. I'm really worried that this young girl may die. I jumped out of the ambulance and got to the emergency room and walked into an extremely difficult and adverse situation with a young girl who now was saturating about 40%, was on 4 different medications for her blood pressure, and looked dusky and gray to a point that it was evident to me that she would likely die if there was not an intervention and we could get her back to Children's Hospital immediately. I stepped out of the room and met her mom and her dad, who were sitting on the floor outside the emergency room, and I got down on the floor with them. And I introduced myself, and I said that bringing her back to Children's, she could die in the ambulance, but that's her only shot at life. And we would need to put her on a machine called ECMO to support her.
Caroline's heart and lungs together, even at the time she arrived, were already showing evidence of advanced failure, which was why she was converted onto ECMO so quickly when she arrived.
So Caroline had an infection that caused an injury to her lungs and virtually shut down her cardiovascular system, meaning her heart was no longer pumping blood effectively around her body. She was getting decreased oxygen delivery to her organs like her brain and her kidney. All of these things are incompatible with life if they go on for long enough. Caroline's lungs couldn't take in the appropriate oxygen and release carbon dioxide in an appropriate fashion. Her heart couldn't pump. This machine could do that for her.
It was incredible. Like the first day when she opened her eyes was just, because she had been on a paralytic for so long that you don't talk to her or see her eyes for months.
6 weeks.
Yeah, it's crazy when she opened. It was such a relief, even though she was still really sick. It's just knowing that she was there. She was still there.
Man, this kid is a fighter. That we need to transition her off of the breathing tube when she was ready and strong enough to really take in deep breaths and blow off her carbon dioxide. That's when we transitioned the breathing tube out.
And she took off. That was it.
I missed you. I love you.
You know, within 2 weeks, she's walking against the furniture,
Yep.
and then all of a sudden she's, I went to the bathroom all by myself.
Yeah.
I think Caroline is a really wonderful example of why we use ECMO, because we can see a child who was healthy suffer an absolutely devastating disease course, and we can see her healthy again.
And when you take care of patients as sick as Caroline, you fully realize that you need these machines, but you need the people. And the people to all work well and collaborate well together here and at WashU, here and at Children's. This is what we do day in and day out. Having those capabilities are what makes us unique in this region and makes us one of the institutions in this country that can provide this level of care.
One of the amazing things about the CDI is the sort of breadth and scope of both research and its applications within the clinical population that we can support. Because if you look at any disease that any child has who spends even a single night in St. Louis Children's Hospital. There are opportunities to better understand, how did this happen? Why did it happen? And if we can understand those, how can we prevent it from happening either to other children or to benefit the child who is spending the night with us to a swift recovery?
I tried to keep everybody's name.
Yeah, he kept a book of everybody's,
And
the nurses.
there were
and
over 40. Over 40 doctors and over 70 nurses
yeah.
that interacted with our little girl.
Thank you for all my doctors and nurses who made me feel better.